What's up, everybody? My name is Dr. Jocelyn Conley, pelvic floor physical therapist. And in this video, I'm going to go over 2 exercises that you can do early on after a vaginal delivery or a C-section delivery, or really anything else, to work on your core muscle performance or to help mobilize the tissues. Let's say if you are trying to prevent scar tissue buildup and overall nerve mobility. The position that we're going to do these exercises will be on your stomach, and you may need a pillow that you put underneath your pelvic region horizontally to get your spine in a more neutral position versus a more arched position from being on your stomach. Regardless of what you are using this exercise for, you want to keep in mind the concepts that I'm going to cover, and that's going to be to get your spine in a neutral position. Regardless if you're using this as a tissue mobilization or a core stability exercise, the concepts are the same. Now, if this does aggravate your symptoms, it's important that you talk to your provider about what could be going on and if this isn't even an appropriate exercise for you. First exercise will be a downward facing or prone knee flexion. First thing you do is you have to get your pelvis in neutral. So think gentle deep core brace. This may mean you're gently connecting with your pelvic floor and drawing your navel gently in towards your spine, making sure that you are not squeezing your glutes to take the arch out of your pelvis. Then you maintain this position with the least amount of contraction needed to keep your spine here. And then bend your knee towards your butt as far as you can go before you lose neutral spine position or before you run out of range of motion. And then you return back to the starting position. And you'll repeat this anywhere from 10 to 15 reps or 60 seconds, 30 to 60 seconds on each side. Looking out for any motion in your lower back. Should not be any arching or twisting back here. The second exercise is similar, except we move our hip in a different direction. We're going to rotate our hip. This way moving your hip in this direction allows you to mobilize nerves like the pudendal nerve and some other pelvic nerves that you don't often hear about. Same position, same setup, except your knee stays bent, foot stays relaxed, and your hip rotates as far as you can before everything starts to go. So this is as far as I can go, and then I'm going to go the opposite direction. And your effort is minimal. The least amount of effort needed to move your leg and to maintain neutral spine. Oftentimes people will squeeze their glutes, and that can overall impact your ability to even perform the exercise at all. Oftentimes people will squeeze their glutes to stabilize their spine, and that's not what we want here, because in the event we use our hip to move into extension, we don't have access to our glutes the same way as if we were using our deep core muscles to stabilize the pelvis. I hope this was helpful. If you thought it was helpful, please press the like button. If you know anyone that can benefit, share this video to them and subscribe so you're notified every time I launch a new video. Well, thank you guys so much for watching. My name is Jocelyn, and I'll see you next time.